All right, good morning, everyone. Welcome to our Wednesday morning media briefing about COVID-19. I'm Carrie Schutte. I'm a spokesperson for the Shasta County Health and Human Services Agency. I will start with our numbers from today. We have a total of 40 confirmed cases since the beginning of this situation. We had one confirmed case yesterday. We have done a total of 5,269 tests. We've got 6 people in isolation, 24 on quarantine, and we've had 4 deaths. We've changed the way that we're reporting hospitalizations, and so we're breaking that out. And so I'm going to tell you that we have no Shasta County residents who are hospitalized with COVID. We do have 1 non-Shasta County resident. Over the course of this event, we have had people from other counties in our local hospitals, but we want to make sure that we are providing an accurate picture of what's going on in our hospitals. So those numbers will hopefully make it more clear to the community about what's going on. And right now we've just got 1. So I'll introduce all of the folks that we have here with us today. We've got, I'm just going to start from the top. We've got Robert Folden from Mercy Medical Center, Val Lakey from Mayors. We've got Matt Pontes, the CEO of Shasta County, and Mark Mitchelson from Shasta Regional Medical Center, Dr. Karen Ramstrom, the County Health Officer, Donnell Ewert, Director of the Health and Human Services Agency, and Dean Germano from Shasta Community Health Center. Do any of you have any updates that you'd like to share before we open to media questions?
I don't think anything new necessarily, but just want to remind folks that, you know, as we see activity, we still have the ability to convert our spaces inside the hospital to what we call negative pressure areas. So as we work with just single patients, we kind of use our normal space, if you will. So we are currently functioning like we do every day, but if we see a surge, we're prepared to go back to a larger negative pressure type environment.
Just want to add on to that. We haven't really provided an update in a little while, but really we're seeing volumes continue to increase within the hospital just for basic medical care. Seems like people are starting to come back to the hospital for their elective procedures, and we're still having a lot of precautions, the screenings out in the front of the hospital. So I just want to thank the community for continuing to be patient with us as we make sure everybody who's coming into our facility is safe, and hopefully getting back to normal-ish as we kind of continue with this process.
Hey, good morning, everybody. This is Matt. I just wanted to say just a couple of things related to some of the protests and activity last night in our streets. And I just wanted to say that I was really impressed by the community support that was out there. The protesters did a fabulous job of keeping peaceful and working with a lot of the other groups that came down to be part of the discussion. And everybody acted professionally, acted peacefully. There was a lot of good conversation going on down there. There was a lot of masks. Now, you know, I don't know about the social distancing for sure, but there definitely were a lot of masks on in the areas that I saw. And, you know, I also want to thank our public safety professionals that were on the outer fringe, just ready to help should anyone get hurt or should there be any kind of other kind of negative activity with anything else. And I think everybody just came together, got some messages out there, and it was really a positive thing. So thank you, everybody, for coming together on that.
I would just add that I was at the protests myself with my mask and keeping away from people more towards the end, probably between 8 and 9. I would say that my observation of the group was most of the people in the group on the streets were not masked and were huddled together. And I was just thinking to myself that if there were any positives in that group, there's going to be a bloom. So, but I appreciate people kept self-control and people were good about it. And there were some tension points, but in general, I thought people were well behaved. I was impressed by that. So I was thankful as well.
Carrie, can you hear me? This is Val at Mears. Okay.
Yes, we can
It
hear.
wasn't working before. I just wanted to give a brief update for Mears also. Our situation is pretty much the same on the acute care side as with Mark and Robert, but with our skilled nursing facility, there are some differences. We continue, to allow no visitors, and that's been a little challenging for our family members. So we're trying to do everything we can possible to accommodate them. And then also because of some state requirements, we have just this week started with testing of all of our skilled nursing residents, and all of our staff will additionally be tested to meet those state requirements.
All right, thank you, Val. Anybody else?
This is Donnell. I just want to mention a couple of things. One, there's been quite a bit of data that's come forward showing that children are falling behind on their immunizations during this stay-at-home order due to closures of various medical offices and people, not wanting to go out. So this would be a great time for parents to pull out that immunization record and take a look at it and see where they may have fallen behind for their child, or call their pediatrician or family doctor and check on that so that we can get all those kids up to date. We definitely don't want to see a bloom of any other communicable disease outbreaks right now, and keeping immunizations up to date is the best way to do that for childhood infectious diseases. I also wanted to mention that we have been looking at some of our mental health data and trying to get things a little bit more back to normal in our own clinic. And so we are reviewing, what we can do in the community to perhaps bolster the general mental well-being due to the COVID crisis. So hopefully the next couple of weeks we'll be able to put together some plans for that and provide some more resources for the community. In the meantime, you can go to shastaready.org, and there are resources on there for mental well-being that folks can access.
All right, thank you, Donnell. Anybody else? Okay, I think we are ready for media questions.
All right, good morning. Dr. Ramstrom, yesterday you mentioned you're working on the alert system for the county. Can you go into as much detail as you have right now as far as what that will be, what it will look like?
Sure. So we have a draft of an alert system that we're hoping to use as a communication tool to keep the public updated on how we're doing in terms of the outbreak as more and more opens up and as we go forward. It's sort of a subset of our larger surveillance plan, the indicators that we think would help us to see early indications of there maybe being a bump, such as COVID-like illness that comes from diagnostic codes, all the way, and we don't want to have to wait until we see an increase in deaths. That's more of a late indicator, but it includes indicators in three categories: disease status, healthcare system, and disease control. So it'll be a combination of those indicators that will help us to know like what level we're at in terms of disease transmission and containment in the community. And we're still sort of in the early stages of fleshing out how we determine which level we're at. And then our plan is to have some sort of a visual indicator on our Shasta Ready website so that the public can be informed about what our disease transmission is looking like. And so we're kind of in the process of going retrospectively going back to see how, if we had this indicator system back in April when we had some of our higher numbers, what might it look like, so that we can make some adjustments and tweaks to what these alert levels measures would look like, so that we can have a best guess as far as a start. We might have to modify it a little bit as we go forward. It's a new way of sort of keeping track of how we're doing in terms of disease transmission, as well as the impact on some of our healthcare system in terms of hospitals, but also our congregate settings. So we look forward to making that available to the public when it's finalized.
Would it be more to let people know where we are now, as well as things that you can do to help prevent more cases from happening, or or is it kind of both?
So what I anticipate, and again, we don't have it finalized yet, I anticipate we would have a level, and so we'll be using green, yellow, orange, and red. And depending on which of the majors kind of landed us in that level, we could make some general recommendations to the public. So maybe we've just bumped up a little bit, and so it's just a reminder to high-risk populations to stay home because it's not safe for them to go out. So it would be a way of making some just, recommendations so the public kind of has a feel for what the risk is as they're out and about, and some general recommendations about what we would suggest they do in terms of their own personal behavior.
And finally, any kind of an ETA on that?
So we're planning to run it by our Roadmap to Recovery Advisory Committee this Friday. And our epidemiologists are sort of plugging in some retrospective numbers so we can see how it might play out. And then we have to kind of get the visualization down. So maybe we might have a preview next week. We'll do our best.
Thank you, Doctor.
Other questions?
Hi, this is Anna Terrea here from Action News Now. This one is going to be for County CEO Matt Pontes. We've seen a lot of protesting happening here across the state, and a lot of counties have issued curfews. Could you see the county issuing a curfew if things get out of hand?
Thanks for the question. So we've seen that across a lot of the urban areas and the really big cities, and at some point, things would have to get pretty bad for something like that. And I think that would be a decision that the Reading police chief and the sheriff would be looking at if things got bad. And when I'm really fortunate, I think we're all fortunate that we have some folks here locally that are really trying to keep those kind of things where it's more destructive out of our protests. And we just have a really good thing now. So I wouldn't want to jinx what we have going on now, but we certainly have everybody doing what they need to. We had a really successful board hearing on Tuesday as well, where people got a chance to come in, voice some of their concerns, and make public comment, and it worked out really good. So I'm hoping that we don't get there. Obviously, those tools exist if we had to later, if things got really bad, but I don't see that in our immediate future.
Thank you for that. And I do have some follow-up questions for any of our health professionals out there. This is kind of relating to the protests, and we're still living in a pandemic. It was addressed earlier. Are there concerns about, people who are asymptomatic possibly spreading the virus? We've seen several asymptomatic cases pop up here in the last couple weeks.
So I agree.
Go ahead,
Go ahead. Sure. So I agree. There is some concern there, particularly as Dean shared that some individuals were not masking and they were closely congregating. There can be disease transmission in those kinds of situations. And so certainly if a person develops symptoms, they want to check with their healthcare provider. But, a person even now who participated, they could actually go on shastaready.org and sign up to get tested out at Shasta College. That would be a prudent thing to do. And as well as just avoiding contact with people who are high risk for the next 2 weeks. I would suggest that at a minimum, so that you're not around older adults and people with who are vulnerable in terms of medical conditions.
Follow up with that, Dr. Ramstrom, a lot of people, as we've seen, protest movement grow, and a lot of other public health officials advising people to get tested. Would you also advise them to self-isolate for that 2-week period?
So yeah, I think as I said, most concerning are the people who can get very, very sick. It's not a bad idea if you think that you might have had an exposure, for sure to self-isolate, but at a minimum, you'd want to avoid contact with people who are at high risk for getting very sick with COVID-19.
And I do have other questions. We've talked about the second wave, so this is for any of our medical professionals. We've talked about a second wave. Could this possibly be the launching point for a second wave? Do we see that happening?
We don't really know how this outbreak is going to play out locally. We could have a second wave. We could have a series of small upticks. We could have more than a second wave. And so the activities such as a protest, I think that kind of activity can be done in a safe manner. But when there's congregating like that and it's not done safely in terms of physical distancing, and certainly if somebody was symptomatic and they attended, that does put us at risk of having disease transmission. And so, as you mentioned earlier, I think taking those precautions, if you did participate, to avoid contact with others is a good idea. So we have our disease investigation team staffed up. And so if we do see an uptick in cases, then we would be ready to respond to do case investigation and isolation and quarantine of those individuals to continue to try and keep disease transmission contained.
This is David Benda with the Record Searchlight newspaper. So I'm looking at all the businesses that have defied orders to open, most prominently all the health clubs in town. And then Waterworks Park is going to open on Friday. What is the county doing to, if anything, to prevent this from happening? Does this county have concerns? Can someone speak to that?
I think we have addressed this several times, but I can try again. Waterworks Park is not allowed to open right now. They were going to open on Memorial Day weekend, and through some interventions, they postponed that. I'm hoping that they will postpone again because they do not fit into stage 2. We don't recommend anyone go there if they do open. So that is the best way to protect yourself, to just stay away for now until we have better, some better guidance on how to manage that scenario. And as far as the health clubs go, we've said before, we encourage exercise. We believe that outside is a great place to do that right now. And the weather is beautiful. And so we should be outdoors enjoying that environment and exercising in that fashion, and people should avoid gyms.
So a follow-up question. I mean, you've made it very clear that they can't be opening. Is there any chance, will anybody cite these businesses? Or I mean, is it just kind of like, hey, you can't open, but go ahead and open? I mean, that's what it sure seems like at this point.
I think our message has been fairly consistent that they should not open until the guidance comes out. When the state guidance comes out for a sector, then the local health officer can allow them to open. Until that time, they aren't allowed to. I think we've been consistent in that message. If they do open, they are not going to be cited. I think we've also stated that fairly clearly. So, it really boils down to the business people doing the right thing and consumers being mindful of their risk. And the higher risk businesses we do not recommend they be visited right now.
Questions?
I also think I'd like to address Anna's previous question about a second wave. I think, we're moving into a period that's quite different than we had initially. So we had the initial wave, and then we had a stay-at-home order, And so we did have quite a few cases in March, and it kind of peaked there at the beginning of April, and then it went down. And as things have reopened, we're getting our trickle of cases. And I think if you look around the North State to the other counties in the Sacramento Valley, up to the Oregon border, you're seeing the same thing. And so you have a county like Lassen that had 0 cases, and all at once they had 5 cases. And Glenn County actually has the highest rate of disease in our region if you look at cases per capita. So they are small, much smaller rural county, much more rural than us, yet they actually have the highest risk at the moment. Butte County's cases have ramped up. They at one time had fewer cases than Shasta. They now have more. Del Norte County's got quite a problem. They're actually on the state's watch list. So, it's going to ebb and flow, and we're going to see clusters, and we're going to see, transmission happening at different rates in different communities. And we are not immune. Very few of us are immune to this disease. And once there's an introduction, we're going, depending on the scenario and the situation where that happens, we're going to see cases. And I think the public needs to be prepared for that. We are not going to always have a trickle like we're having now. At some point, something's going to happen. And that's why we all need to remain vigilant. We all need to reduce our risk as much as possible. So that means, yes, we want businesses open. We want people going back to work, but we don't want mass gatherings. We don't want unnecessary gatherings. And the more people adhere to those pieces of advice, the less the risk. So again, people sometimes ask, well, if we can do this, why can't we do that? Exposures add up. So the more we reduce our exposures to other people outside of our households and limit the places we go and to the essential things we need, the less transmission can occur. And we can keep the low incidence that we have right
now. Thank you, Donnell. Any other questions?
Well, thanks, Donnell, for also reiterating on that. I really appreciate it. Well, you talked about the mass gatherings, and it's always been advice of public health to prevent large gatherings of more than 10 people. So, can you elaborate a little bit more on that? Because we're seeing more than 10 people, obviously, like groups of people over like 50 coming out to these gatherings, to these protests, to these march. Can you just elaborate a little more, like how this could impact?
Sure. Well, until a week ago, there were no gatherings allowed under the governor's order, not even up to 10. So we were anticipating that there may be some loosening to allow that, but that never happened. And so last week, the governor allowed 2 types of gatherings. He allowed church services up to 100 or 25% of building capacity, whichever was less. And he allowed protests up to 100 people. So those are the 2 types of gatherings that are currently allowed in California. And in addition, there's guidance as to the social distancing and masking that is encouraged in those situations. And there's a lot of guidance actually for both of those scenarios. And the more people adhere to those things, the less the risk. So, I think there was some masking at the protest yesterday. It definitely wasn't universal. And, what we can hope for is that there wasn't any virus there, but of course we can't know that. And as Dr. Ramstrom said, if you were at a protest, it would be advisable to go to the test center and get tested. It's free of charge. And that will give you information and give us information about what may have happened there.
This is Dean. A question for Dr. Ramstrom. If you were at the protest, it's just a timing issue, because it takes a certain amount of time for, if you were exposed to the virus, to kind of seed itself. What's a good timing window to go get tested if you were there?
Yeah, we don't really have great information on that. What I would say is maybe a week following, and maybe 7 days after that. That might be a strategy. You're right. So if you just attended yesterday, going today might not, be fruitful because you haven't had enough time to actually develop the virus in your nasal passages. And so that would be a suggestion. If you're going to go once, maybe in a week. Definitely, if you develop symptoms, you'd want to contact your healthcare provider.
All right, any other questions? Seeing no green lights. Okay. Possibly a new record, 11:28. Thank you everyone for being here today. We will be back next Wednesday at 11 o'clock, and we will have our daily updates posted on our Facebook page and website every evening between now and then. All right, thanks everyone. Enjoy the rest of your day.
Thank you, you too.